Welcome to the Empowered Flow podcast. I'm Alexandra, holistic clinical nutritionist, women's health and menstrual cycle educator, and mama. Join me and experts in nutrition, fitness, mindset, and holistic healing as we explore conversations to open your mind to a different way of thinking on all things women's health, hormones, periods, cyclical living, and fertility. Whether you're seeking knowledge, inspiration, or a supportive community, you've found your tribe. Let's dive in. Hello, it's Tris here back for another solo episode, and today I really wanted to share something for all my PCOS girlies or PCOS girlies. I use PCOS and PCOS interchangeably, but it stands for polycystic ovarian syndrome. So this episode really is for you if you're someone who has been diagnosed with PCOS, or perhaps you have the signs and symptoms, you're in the middle of being diagnosed, or you're not really sure where to turn and where to go when it comes to struggling with the symptoms of PCOS. What I really want to share with you and what I want you to know from this episode is to walk away knowing that resolving your PCOS symptoms is absolutely possible. I won't go into my own story, my own journey with PCOS, because I did that in episode 1. So you're more than welcome to jump back into that episode if you want to hear a little bit more. But I want you to know a few things when it comes to PCOS. The first one is that healing your PCOS symptoms is possible and you can thrive with PCOS. It doesn't have to define you. And I do mean you can resolve those symptoms. So the irregular or missing periods, the too light or too heavy periods, the acne, thinning hair on your scalp, hirsutism, so that's like dark hair growth on areas like your chin, your chest, or below your belly button, weight gain or difficulty losing weight if that's something you're experiencing, and even some of the lesser known symptoms that are associated with PCOS. So a lot of my PCOS girlies and myself have experienced things like strong cravings, constant hunger, like exhausting fatigue, anxiety, insomnia, or really, difficulties with sleeping, and even body image issues. And a lot of this comes from the hormonal imbalances that's going on underneath having PCOS. So whilst I guess there is no quote unquote cure for PCOS, it is possible to actually resolve those symptoms. Now, the reason why I wanted to share this is because I had a client recently tell me that before she started working with me, she was Googling and reading studies. And she was just feeling like everything she was reading about PCOS just felt like doom and gloom, that she was just destined to feel crappy and she was destined to be worried about her future health and her risk of chronic diseases. And it just didn't give her any sort of like positive, just anything positive to move forward with. And when we worked together and we talked through a lot of these things, she realized that not only did she actually resolve her symptoms, but she felt really empowered. She felt like she had the information, the tools and the resources and the knowledge so that she could go forth and just continue to support her health, continue to naturally support hormone balance, even if things popped up in the future. I talk about we might resolve symptoms and then you might go through a stressful period of your life, or something else might happen where some of those symptoms start to show back again. And I always say it's not, your body isn't broken. It's just your body giving you signs that something's not quite right and it needs that little bit of extra support. And that's okay. Like, we go through stressful periods of life and they can impact our hormones, and then we might start to see worsening of symptoms, or we might start to see the return of irregular cycles or anything like that. But once we have the tools and resources to know what to do when those signs and symptoms pop up, it feels really empowering and we can feel really confident with the choices that we make for our nutrition and health. The other thing I want you to know is that falling pregnant with PCOS is possible. And I know this might sound really triggering or might sound really, difficult for people to hear, particularly if you're in the thick of it when it comes to trying to fall pregnant right now. So I just want you to know that I see you and to just have compassion for yourself, and also just hold on to that hope, because I want you to know that a diagnosis of PCOS is not a diagnosis of infertility. And yes, every couple and every person's fertility journey is going to be different regardless. And that doesn't mean you won't necessarily experience fertility challenges, but I guess our role as practitioners in many different fields, not just in nutrition, but many different fields where we work in fertility, our role is to uncover the underlying causes, the root causes of why there may be some difficulties in falling pregnant. So yeah, there's that one. The other one I want you to know is that healing PCOS does take a individualized approach that addresses your root causes. So we're looking at the underlying reasons of why the hormones are imbalanced, and some of the things that we can do with nutrition, lifestyle, and our environment to address those root causes. And I'll talk about those root causes in this episode. So let's talk about getting diagnosed with PCOS, because some of you may be listening in and have already been diagnosed, but potentially not understanding how that diagnosis came about. Some of you may have the signs and symptoms, haven't yet received a diagnosis. I actually see women sometimes who have been misdiagnosed, and it's other things going on with their hormones that is actually contributing to symptoms, even though their signs and symptoms might look a little bit like PCOS. So the diagnosis of, and also as a clinical nutritionist, it is not my role to diagnose. That needs to be done through a doctor or a specialist like a gynecologist or even an endocrinologist. But I just want to give you what the criteria that is used to diagnose PCOS. So it's called the Rotterdam criteria, and you need to have 2 of the following 3 to be diagnosed with PCOS. So number 1 is in an irregular menstrual cycle. An irregular could be anywhere above a 35-day cycle. So if you have below a 35-day cycle, that can be considered normal if you're not showing any other signs and symptoms. But if your cycles are longer than 35 days, that is considered irregular. Some women with PCOS will have incredibly long cycles. You might only have a few menstrual cycles and a few periods a year. You may go months and months and months on end without seeing a period at all, and that can be really common as well. Now, when I say menstrual cycle, your menstrual cycle starts on day 1 of your period, so that is the first day of full flow, and it goes until your next period. So the amount of days between day 1 of your period until you get your next period is your menstrual cycle days. The second criteria is having clinical signs or symptoms of hyperandrogenism. And what that means is high levels of androgen hormones. Now, androgen hormones contribute to the symptoms like acne, thinning hair on your head, hirsutism, so that dark hair growth, and you may also get a blood test and test either testosterone, androstenedione, or DHEAS. Any of those markers may show up as elevated. They may not, but you may have the actual symptoms of high androgens, like I've just explained. So you don't necessarily have to have them show up in a blood test, but you do either need to have the symptoms that I've just explained or have them show up in a blood test. And then the third criteria for the Rotterdam criteria is polycystic looking ovaries on ultrasound. So what this means is the ultrasound of your ovaries will show multiple follicles, and they call these follicles cysts. It's not really the right way to describe them. They're not actually ovarian cysts. They're not the same as ovarian cysts. What they are is immature follicles in the ovary that haven't matured to be ready for ovulation. And so on the ovary, it kind of looks like, on an ultrasound, looks like a ring of pearls around the ovary. Not every woman with PCOS will have polycystic ovaries on ultrasound. So like I said, you need to have 2 of those 3 criteria to be diagnosed. The other more recent diagnostic criteria that is being used is something called AMH, or anti-Müllerian hormone, and typically that is elevated in people with PCOS. It's not part of the Rotterdam criteria, but it can be quite diagnostic in if your AMH levels are high. It is pointing towards potentially having PCOS if you have some of those other signs and symptoms. Just to also know that AMH whilst it's used as a marker of fertility, it's not actually indicative of whether you're able to conceive, or not really a marker of your fertility. And what I mean by that is, if you have low AMH, some women have been told that low AMH means they can't conceive. It's more about the quality of eggs and the quality of sperm, not how many you have. And as I've just mentioned with PCOS, you could have high AMH levels and maybe still have some difficulties in conceiving if we're not working on the hormones and underlying root causes. And then the final marker that some doctors will look at is the ratio between FSH, which is follicle stimulating hormone, and LH, which is luteinizing hormone. And in many PCOS women, the LH luteinizing hormone will be high, and it'll be high all around the cycle. So in a normal cycle, luteinizing hormone would only spike right before ovulation, and it would trigger ovulation. But in PCOS, it may actually be high throughout the entire cycle. And that's why the ovulation predictor kits are not always accurate for PCOS women, because if you do have high LH, those ovulation predictor kits are looking for that elevated LH level to say, yes, you've ovulated, but if your LH is high throughout the whole cycle, you're going to keep getting positives even though you haven't actually ovulated. So just be conscious if you are using, or if you are trying to fall pregnant with PCOS, that ovulation predictor kits may not be accurate at all. And I teach my clients natural fertility methods and how to use the signs and symptoms of your own body. So looking at basal body temperature, BBT, and cervical mucus changes throughout your cycle to predict and confirm whether ovulation has happened. I do have an upcoming masterclass called Sync Your Cycle, which I'll be teaching natural fertility methods and many more things about the menstrual cycle. So I'll link that in the bottom of the show notes if you're interested in finding out more as well. Now, I wanted to share some of the, shortfalls that occur in the healthcare system when it comes to diagnosing and treating PCOS. And this is not at all to rubbish doctors or rubbish the healthcare, rubbish medical science or anything like that. It's really just that we have a healthcare system that's still catching up with the latest science on PCOS and how to treat it. And sometimes some of the approaches used in the healthcare system, whilst can be really helpful in reducing symptoms, are what we kind of call band-aid quick fixes. So, if we're looking at something like using the oral contraceptive pill to quote unquote regulate your cycles in PCOS, it's not actually regulating your cycles, it's not actually balancing hormones, and so it's more of like a band-aid treatment to give you a breakthrough bleed every month rather than actually getting to the root causes of your PCOS to balance hormones naturally. So that's probably one of the things I see is using those like band-aid quick fixes like the pill or metformin. The other thing that I see often is just inadequate testing, and again, it's just about the healthcare system catching up with the science. But when we don't get adequate testing, or we just get some generic testing, or it's just the real basics to diagnose PCOS, we then struggle to find out what the root causes of your PCOS are. And I'll explain that in a little bit more detail about why each woman with PCOS experiences it differently and has different symptoms and different root causes. But testing can be really beneficial, and I'm talking about like predominantly blood testing can be really beneficial in understanding more about your unique PCOS, what your underlying root causes are, so that when we use nutrition and lifestyle strategies, we're targeting it to your unique signs and symptoms and root causes. The other thing I see happen a lot is just women feeling really disempowered. And this is something that I experienced, just walking away feeling like I had no control over what was happening, feeling really disempowered because I didn't receive informed choices or didn't receive all of the information to make the best choices for me. And I truly believe that you should be empowered and informed with all of the information and all of the choices when it comes to your healthcare regardless. so that you can make the right choice for you. Because what I feel comfortable with and what I feel is right for me may not be the same for you, and that is totally okay. I would never, with a client, I would never tell them what the right thing is for them to do, but rather give them all of the information and ways that they can resolve their own PCOS so that they can make those choices. So for one woman, going on the pill may be it may just not resonate with them and may not feel right. For someone else, they may need that for, whether it's a short period of time or not, they may feel like that's the right choice for them in the moment. And all of that is okay, but it's about making that choice of what are the benefits and what are the risks in utilizing this treatment? How is it actually going to help me? And what are the other options that I have available? The other big mistake that I see being made is PCOS women being recommended really restrictive diets, or it might be ketogenic diets or low carb diets. And whilst none of these are necessarily wrong, or in some cases they may be helpful, they're not the right approach for every single woman with PCOS. And what I think is more important is understanding how to eat in a way that balances your blood sugar levels. So using the right amount of macronutrients like protein, carbs, fats, and fiber in each meal. And also understanding what the right amount of carbs are for you, because that's going to differ from person to person, depending on a lot of things, including physical activity and including how insulin resistant or sensitive you are. And then understanding the best ways to get those particularly carbohydrates into your diet. So where should they come from, rather than just everyone with PCOS should go on a keto or low carb diet, which I completely, it's not a cookie cutter approach, and everyone needs to be treated individually. I also see a lot of women with PCOS just wasting a lot of money on supplements, just going out there and Googling and buying every supplement that's targeted to hormone balance or to PCOS, and it may not be the right thing for you. Yes, there is some really effective evidence-based supplements out there for PCOS. Things that I use often include myo-inositol, berberine, magnesium, and just depending on your other root causes, there may be some other supplements, but you don't need every single supplement, and not every single supplement is going to be effective for you. So I really do think personalized treatment when it comes to supplements is the best way to go. I know it's not accessible for everyone, but I also don't want women wasting hundreds of dollars on supplements that aren't effective for them. Just while I'm on supplements as well, there is actually some really good research showing that berberine, myo-inositol, and magnesium have been found in studies to be as effective, and in some ways more effective, than metformin at improving PCOS symptoms. Now, I'm sharing that simply to inform you. It is not personalized advice. It is just so that you know that there are other options that you can explore, and it doesn't always necessarily have to come down to medications. Metformin does have side effects for a number of women. They get a lot of digestive symptoms like nausea and loose bowel movements. Metformin does deplete vitamin B12 and also impacts folate balance. So if you are on it, it's just something to consider getting both of those nutrients tested and potentially looking at supplementing to support alongside that. But again, there's a lot of considerations. It's not personalized advice. When it comes to the pill, so hormonal birth control, the oral contraceptive pill, and PCOS, just something to be mindful of, particularly I know because this is prescribed really commonly for PCOS, is that when you stop hormonal birth control or stop the pill, you will get what's known as post-pill PCOS. And that means that when you stop the pill, you'll get a rebound of excess androgen production. So androgens being the hormones testosterone, androstenedione, or DHEAS. And they elevate and you will get a return of symptoms. Now that typically happens mostly in the first 3 months of coming off the pill, but can be prolonged. And I do see women who have been off the pill for 3, 6, 12 plus months and are still experience either irregular or no menstrual cycles, or very, very sparse menstrual cycles. And so what what I try and do with my clients and what we do using nutrition and supplements and lifestyle is start to target the underlying root causes of your PCOS before coming off any oral contraceptive pill, and then really doing lots and lots of support post pill so that we minimize those effects and reduce how long those effects might last for. For some women with those extra supports in place, you may not experience that at all. Again, not personalized advice, and not, it's not advice to say whether you should or shouldn't come off the pill at all. It really is just so that you have that knowledge and awareness so that you can support your body with whatever choice that you're making. Now, if you are sitting here going, Tris, you are talking all about hormones and androgens and PCOS and hormone imbalances, and I'm completely overwhelmed already. I don't even know what PCOS is apart from being told that I have it. Girl, I get it, because that was literally me when I was diagnosed. I had no idea what it meant. I only knew that I was experiencing these symptoms that I was wanting to, get to the bottom of and resolve. But just to give you a little bit of an understanding about what is going on and what those hormone imbalances are that's going on with PCOS, is what we're typically seeing is these high levels of androgen hormones. So like I said, testosterone, androstenedione, or DHEAS, and they can all be tested on a blood test. Now, those androgens are converted to something called DHT, or dihydrotestosterone, in the body, and they travel to different cells in the body. And that is what triggers the symptoms of PCOS. So the main ones that those particular hormones will trigger are hirsutism, thinning hair, acne or oily skin breakouts, weight gain, particularly around the middle, and they will also impact ovulation. So they will block or interfere with ovulation, or the maturation of eggs and ovulation happening, and that's where we start to see the irregular cycles. Now, there are some other hormones in PCOS that do become imbalanced as well, particularly insulin. And this is not for every single PCOS woman. So something I always say is that everyone with PCOS will experience it differently, have slightly different signs and symptoms, and slightly different underlying root causes. One of those is insulin resistance, and that is another hormone that can become imbalanced, and insulin can contribute to symptoms like irregular cycles, weight gain, fatigue, difficulty in sleeping. There can be quite widespread signs and symptoms of that. I used to talk a lot about like the PCOS types. You might have heard of like the 4 PCOS types. They are relevant in the sense of like it's important to know whether you have insulin resistance or not, because it's about 75 to 80% of PCOS women will have some level of insulin resistance, but not everyone will. And that again means that things like low carb diets may not be completely right for everyone. So I think it's important to understand what your type is, or what your main type is, but what's really more important is to understand what your underlying root causes are. So let's then dive into what the root causes of PCOS are, because I keep talking about root causes and underlying causes, and again, can become a little bit confusing. So I guess the main root causes of PCOS, so these are the things that are contributing to high levels of androgens and causing the symptoms, but they are also the things that we can target with nutrition and lifestyle and supplementation so that we're actually resolving symptoms from that root cause. So the first one is blood sugar imbalances. Now, when we eat in a way, and there's things other than food that can contribute to blood sugar imbalances, but the way we eat and the macronutrients, so protein, carbs, fats, and fiber in our meal can impact our blood sugar response to a meal. And when that is dysregulated and we're getting highs and lows of blood sugar, that will not only contribute to more androgen production and the symptoms of PCOS, but over time it can lead to high levels of insulin and insulin resistance. And that's where we see insulin resistance in about 80% of PCOS women. The other root cause is inflammation. We're really seeing this in most women with PCOS. Inflammation in the body could be coming from anywhere. It could be coming from the gut. It could be systemic inflammation. It could be from, food intolerances, a number of things. Our diet can contribute to inflammation. Now, this can directly increase androgen production again. It can also impact our metabolic health, so insulin resistance, or our blood lipids, so looking at cholesterol levels and fatty liver. And it can also exacerbate autoimmunity if there is autoimmune conditions present alongside PCOS. So I often see PCOS and Hashimoto's together. Another root cause, and this is something I work on with every single one of my clients anyway, but in PCOS we do see gut dysbiosis, or an imbalance of good and pathogenic bacteria in the gut, or some signs and symptoms of, the gut and digestive function not being optimal. And any of that can not only contribute to inflammation and blood sugar imbalances, but our gut plays a role in so many other systems of our body and can impact our sleep and our mood, and can impact our, production of hormones and our immune function. So the gut is a really, really important place to be really nourishing and be really supporting with nutrition and lifestyle to get to the root cause of PCOS. Another really big root cause, and one that we definitely need to work on when it comes to PCOS symptoms and hormone imbalances, is stress, or our nervous system, like supporting nervous system regulation. We live in a modern lifestyle and culture that is, many of us are walking around really stressed, really busy. A number of women I see will often feel like they don't even recognize the stress. They're so used to it, or they're like, I don't feel stressed, but there's a lot of stresses going on in their life, and it can contribute to nervous system dysregulation, or kind of like being stuck in fight or flight mode. So that is our sympathetic nervous system state. Now, that can definitely contribute to dysregulation of hormones. The body's basically saying it's not safe to reproduce, it's not safe to ovulate, and that's when we start to see irregular cycles and all sorts of hormones going out of balance. So we can definitely use even nutrition. There's certain nutrients that get really depleted under stress, so magnesium, B vitamins, vitamin C. We can use our diet, we can use lifestyle and self-care practices, and even there's lots of other body work and other modalities as well, like somatic practices, yoga, breath work. There's so many techniques we can use to regulate our nervous system. But it's really about finding something that you can do as a regular practice that is going to help you continually get yourself into that parasympathetic nervous system, or that rest and digest state. The other root cause, I guess, not so much, it is a root cause, but just one of the things I see a lot in PCOS is nutrient deficiencies. And it's something that we will do some blood testing on, or that I do blood testing on with my clients. Vitamin D is a really big one. It's often seen quite low in PCOS, and that can contribute to hormone imbalances and also gut dysfunction. Zinc, if zinc is low, it can contribute to high androgens. And so zinc is another really good potential supplement. And then omega-3s. So omega-3s can be tested through something called the omega quaint test, where we're actually testing your red blood cells and how much. So every cell in the body is basically surrounded by a fat layer, and we want to test how much of that fat layer is omega-3s. And that can contribute not only to optimal health, but we're really wanting to use the omega-3s to reduce inflammation and reduce the symptoms of PCOS. Now, one other thing that I do test for in PCOS that is very common is thyroid dysfunction. So when it comes to testing the thyroid, we're looking at a full thyroid panel. So TSH, which is thyroid stimulating hormone, that is something in the brain, and then also T4, T3, and reverse T3, as well as thyroid antibodies. Most doctors will only test TSH. The problem with that is it doesn't give us a full picture of the thyroid. It's not, that could be normal, and you still have other markers of thyroid dysfunction that isn't being tested. So it's really important that we look at a full thyroid panel. So now that we know the root causes of PCOS and a little bit more of an understanding about what's going on with our hormones, it kind of leads to, well, what now? How can I use nutrition and self-care or lifestyle and supplementation to reduce and resolve symptoms? Now, of course, it is going to be a personalized and individualized approach for each person with PCOS. But what I wanted to give you was just an overview of some of the things to consider in your nutrition and lifestyle. Some of the questions to ask yourself about, like, am I doing this, or is this an area that I could look at improving? Because really, all of these things are addressing all of those root causes, and we want to optimize all of that. We want really good blood sugar balance. We want really good gut health. We want low inflammation. We want our liver to be functioning really well. All of these things are going to help to resolve PCOS and any hormone imbalances and then the symptoms that are going on. So the first thing I want you to think about is your diet. Are you eating a predominantly whole foods diet? So think about foods that are as close to nature as they can be. It doesn't mean absolutely everything can't come from a packet, but just predominantly, is your diet made up of fruits and vegetables, good quality meats and animal proteins, dairy, a little bit of grains that are properly prepared, or lentils and legumes if you can tolerate them well? Are you including some really good healthy fats like extra virgin olive oil, olives, nuts and seeds, avocado, and not using inflammatory seed oils? Are you cooking predominantly from home, or are you eating out more? So these are just some of the things to consider at your overall diet. So rather than focusing on like, I have to cut out X, Y, and Z, I want you to consider about what's coming into the diet and what you're eating in abundance. The other thing to consider is the quality of any packaged products you're buying. So it's about looking at the labels and choosing things that don't have, the inflammatory seed oils or don't have preservatives and additives in there, choosing the best quality version of that product that you can access and afford. So it may mean making some swaps and changes to like your breads or your milks or plant-based milks or your yogurt or any of those sort of products that you're buying on a regular basis. The next thing to think about with your diet is, are your meals contributing to blood sugar balance? Firstly, are you eating enough protein in each meal? So aiming for at least 30 grams of protein in 3 main meals a day, and then potentially a snack or 2, just depending on your preferences. Are you eating enough protein? Are you eating, the right amount of carbs, fiber, and fats? Are you eating regularly throughout the day? Are you avoiding really long periods of fasting? And whilst, a 12 to 14 hour fast overnight can be really beneficial, you certainly don't need to be going long periods of fasting. And also things like skipping breakfast or skipping meals regularly is not great for blood sugar balance and something that we want to try to avoid or reduce. Then when it comes to your lifestyle, consider movement. Are you moving your body on a regular or daily basis? It doesn't always have to be structured exercise, although that is highly beneficial as well. But are you moving your body in some way every day, whether it's a walk, whether it's structured exercise, whether it's strength training or cardio or a Pilates or yoga class, whatever it may be? The more that, movement is medicine, and there's so many benefits to exercise, not just for weight loss, completely take weight loss out of the picture. There is so many other benefits for our metabolic health, for longevity, for our mental health, and so much more. The other thing to consider is, do you have any practices in your life that help to regulate your nervous system? So any of these things could be helpful, but it's really up to what resonates with you and what's practical and achievable for you. But things like walking in nature or getting outdoors in the sunshine, meditation, breath work, journaling, yoga. There's so many somatic practices like dance and other practices like that. And then the last thing to consider, and this is of course not going to be for everyone, but just to consider working with a practitioner one-on-one. It doesn't have to be me, anyone that resonates with you that has a really strong knowledge in PCOS and is either like a clinical nutritionist or a naturopath, someone that specializes in that area and can help you understand your root causes. Do some proper testing, so some blood testing or functional testing where we are analyzing those tests from a functional perspective and looking at what could be contributing to your symptoms, and then using personalized nutrition and lifestyle and supplementation strategies to target your root causes to be able to resolve symptoms. So I hope this episode's been helpful. I know I've thrown a lot out there. I just want you to know it is a process. It is a journey. You don't have to do everything overnight. I would never expect my clients to make every single change overnight. And that is where working with someone can be helpful, because we give you that step-by-step process and guidance so that you're not becoming overwhelmed and trying to do all of the things all at once, which none of us can really do. It's not practical, not achievable at all. Doing one thing at a time and really nailing, one habit or one thing when it comes to our nutrition and lifestyle can really make all of the difference, and then builds our confidence and our trust in ourselves to then go on to the next thing. So if you have any questions about PCOS, if you're not sure where to turn to, if you're just looking for some further information about what could be helpful for you, you are more than welcome to reach out to me on Instagram at Alexandra Nutrition. You can book a complimentary wellness clarity call. So this is like a 15-minute video call with me where we chat about what's going on for you, what your health concerns are, and whether I might be able to help you. And then it's totally up to you. There is no obligation to book. I just talk to you about, the ways that I work and what I can offer you. So you can book that. I'll share the link in the show notes as well. And then, as I mentioned, I do have my upcoming Sync Your Cycle Masterclass, which is on Wednesday, the 10th of April, 7:30 p.m. Australian Eastern Standard Time. I will share all the details in the show notes, or the link in the show notes with all the details anyway. That is really for you if you're wanting to learn how to use cycle tracking, nutrition, and lifestyle to balance your hormones naturally, or whether it's for your coming off hormonal birth control and wanting to understand more about natural fertility methods. So I'm so excited to share that information. It's share that education with women. It's one of my absolute favorite topics. So thanks for listening, beautiful ladies, and I will see you next episode. Thanks for joining us on the Empowered Flow podcast. If you enjoyed today's conversation, I'd love you to share it with a friend and take a moment to rate, review, and subscribe. Your support means the world and fuels our mission to empower women everywhere. You can also reach out to me on Instagram at Alexandra Nutrition. Sending big love. I'll catch you in the next episode.